And now, Yahala with Dr. Abu Shanab, brought to you by Bridgeview Chiropractic.
أهلا ومرحبا أعزائنا المستمعين في حلقة جديدة من برنامج يا هلا مع الدكتور أبو شنب. معكم يوليا ريحاني من وراء المايك وخالد خلفة في الإخراج، وأكيد بنرحب بضيفنا لليوم الدكتور رشيد أبو شنب. أهلا وسهلا فيك، كالعادة بتشرفنا.
Thank you very much, Julia. Good to see you.
شكرا دكتور. يا هلا مع الدكتور أبو شنب هو برنامج يأتيكم كل يوم اثنين الساعة 4:30 بتوقيت شيكاغو على راديو يا هلا فويس، وبرنامجنا مهم كتير لأنه بيقدم توعية صحية هامة وضرورية حول كل ما يتعلق بعلاج العظام وآلام المفاصل والظهر وإصابات الحوادث وغيرها من المواضيع المتعلقة بالعلاج الطبيعي وتقويم العمود الفقري. طبعا بدي أعرف بالدكتور رشيد أبو شنب باللغة الإنجليزية. دكتور أبو شنب earned his doctorate degree from National University of Health Sciences in Lombard, Illinois in 1997. He was a faculty member at the school until 2000. He earned his degree as an independent medical examiner in 2004 and his master's in advanced clinical practice in 2012. Now, Dr. Abu Shanab has two clinics, one in Bridgeview and the other in روميوفيل. واليوم دكتور رشيد رح نركز في حلقتنا على الخدمات العلاجية والطبية والطبيعية يلي بتوفرها حضرتك وكمان بوفروها زملائك في العيادات التنتين اللي ذكرتهم في بريدجفيو وفي روميوفيل كمان. طبعا رح نذكر للمستمعين في نهاية الحلقة العناوين والأرقام التليفونات للعيادات Bridgeview and Romeoville Chiropractic Centers. رح نركز على الخدمات اللي بتوفروها هناك، بس أول سؤال دكتور رشيد، ذكرنا بشكل عام إيش هو الكايروبراكتيك؟ What is chiropractic?
Well, thank you very much for having me, Julia.
Thank you.
Chiropractic, just in the name, yani the word chiro, it's the hand, and the word practice is the practice. So it's actually the practice of the hand لتقويم العمود الفقري أو adjust the spine نخلي العمود الفقري مستقيم 100%. So chiropractic, it's a healthcare profession, focuses on disorder most likely is the musculoskeletal. زي ما تقولي back pain, neck pain, arms, leg numbness, tingling, headaches, anything related to the musculoskeletal, it's actually related to the chiropractic. And in turn, the spine itself hosts the most important system, which is the nervous system. And if you affect the bone of the spine, that you affect also the nervous system. So the chiropractic in general is the study, but when you say a chiropractor, you're actually dealing with a chiropractic doctor who practices without the use of drugs, without the use of surgery. It's just a hands-on approach using patient examinations, diagnosis, treatment, rehab, exercise, all in which sits under the chiropractic umbrella in the state of Illinois.
And it's very important because some of the people think like chiropractic only includes the bones and fixing the bones, but it's all correlated. All our organs in the body is very actually linked to the chiropractic.
Chiropractic, absolutely, it affects, this is the only thing we do, is we work on the bones and the joints and alignment of the spine and everything related to the nervous system. So whatever you do, it has to go through the spine to go to the brain. So misalignment of a bone in the spine, of course, affects the function of that amazing system, and that interferes with your health as well.
And you mentioned earlier to me when we were talking that even headaches and other kind of pain in the body could be also caused by such misalignments.
Correct, because when there is a headache or some kind of misalignment, the amount of circulation to cause the headache or the pain, it either increased or decreased.
Yeah.
And if you're dealing with a joint, the joint either hypermobile or hypomobile. So it's maybe a joint too aggressively moving or too low of a move. So with chiropractic adjustment, you just adjust it, you move the bone or remove the bone above it or below it to actually normalize the function of it.
Dr. Rashid, could you please highlight how chiropractic is different than any other treatment?
The most thing chiropractic do, it's actually the spinal manipulation. And it's also called the chiropractic adjustment. And this is what chiropractors do, and this is what we go to school for. And the purpose of it is to manipulate the joint in the neck, mid-back, lower back, or the extremities, in the knees, shoulders, to actually take out any kind of restriction that the joint have, to make the tissue injury resolve way quicker by allowing more mobility to it. I mean, exercise makes you better. That's what's chiropractic about too. We restore joint function, and that's what makes the inflammation, the pain diminishes, increase circulation, restoring mobility. That, in the end, the goal is to actually alleviate the pain, decreases down the tightness. And of course, when you decrease down the inflammation, the tightness, you allow the tissue to heal and the pain goes away.
Right. Doctor, what are the most common injuries that you deal with, and how do you treat them?
The most common one we always see, it's spinal injury, in specific lower back pain. Like if I go through my files at the office, for the clinic, over 80% of the patients we see, the first words say lower back pain, lower back pain, lower back pain. So it's like by far it's the most
90% of the patients have lower
yes.
back pain.
But see, the lower back pain, it's common because maybe somebody woke up with it, but other cases because of an injury, like a car accident, a work-related injury. They lifted something, they pulled something, the wife pulled them, the husband pulled. So it's all related to the spine. So the lower back is that's the one we really see it common.
And how do you usually treat those kind of injuries that are related to the lower back, maybe, or other injuries as well?
Well, in the beginning, we really have to examine them, do testing for them, x-rays. That's very common for the chiropractic office. We depend on the x-rays and diagnostics very much. So the appropriate treatment, depending on the diagnosis and how much the patient have the pain, the sooner they came in, the better off. So it's definitely case specific, is how to treat specific case. It's not one treatment for everybody. Some people just need the adjustment only to restore the joint function, but other people need a little bit further, maybe vitamins, maybe nutrition, nutritional vitamins. They might need some kind of physical therapy, strengthening, stretching, massage therapy. So it's the treatment case specific.
What are the symptoms for the lower back pain? Is it just regular pain that patients have, or there are other symptoms as well?
Symptoms of lower back pain, it's really very common to have the back pain only down the leg or something, sciatic pain. That's very common we see. But we see in other cases, people have abdominal issues, like abdominal pain to the right lower section, left lower section. That all
Interesting.
come in as back pain. We have patients even have back pain because of constipation. So the pressure on the stomach that causes pressure on the back, on the nervous system, and that's what really most common happen. Besides the nerve pain, there is also internal viscera, it's called, per se, where your organs actually hurt too.
I would like to talk more about the nervous system, the autonomic nervous system. هو الجهاز العصبي. كلنا بنعرف إنه بتوصلنا الأوامر في الجسم عن طريق الجهاز العصبي. حتى الألم إذا في إشي بوجعنا بوصلنا عن طريق الجهاز العصبي. لما بيكون the bone is out of the alignment, will that pinch a nerve?
Wow, that's really beautiful, mouthy question. So talking about the nervous system, we need hours. But the nervous system, the way you look at it, it's actual motor, like the main engine of our body is the brain and the spinal cord. And this is called the central nervous system. And this is the one where all the information, if you want to move your finger, it has to go through the spine to go to the brain for you to move it. If you want to point your nose, it's the same thing. If you want to lift your toe, it's the same thing. So interference with this nervous system that passes through the spine, it will alter your lifestyle. It will change the way you do things. So a large portion of your nervous system passes through your spine. It's your spinal cord, the one inside your bones in the back, that acts like, I would say, a cable, like a big cable, without any interference, existing from the brain, coming all the way down to your toes. So imagine this nervous system like a garden hose. And that garden hose has no interference, nothing's touching it, so the water come in normally from the top to bottom with no issues. But if there's a little kinks, if there is a bone hitting it, if the rock hitting it, of course that function of that garden hose will be diminished. The amount of water coming out will not be as fluent and strong as there is no interference on it. So the same thing, if you think about the interference, it's like the bone pushing the spinal cord, and the garden hose is actual nervous system and your actual spinal cord itself.
So any small alignment in the bone could cause nerve to be pinched.
Yes, and this is what's very common to have a pinched nerve. So if the bone is out and that pinches the nerve, now when the bone is out, there is a term, I don't know if you can be able to pronounce it, it's called subluxation.
Subluxation.
There you go. It's actual misalignment of the bone. So when the bone is misaligned, if it's turned, if it's going too much forward or going too much back, that interferes the nervous system that we discussed earlier.
What can cause that, Doctor?
Anything. A good cough, a sneeze, lifting,
Oh, really?
pulling. Absolutely.
Even sneeze?
Even a sneeze. If you sneezed hard, if you put it in, depending. So a subluxation also, it's really not painful. You don't know you even have it. Then with time, 2-3 weeks from now, it's like, oh yeah, my arms start to hurt. So it's really,
it gets worse with time.
It gets worse, and you know, some patients a little bit more like don't feel the pain right away. They actually have a high tolerance for pain.
Yeah.
The bone is out. They feel like, oh, maybe I woke up wrong, or I turned around and it felt a little bit stiff, but you know, I'm much better now. But 2-3 weeks from now, it starts to be a little bit worse, and this is when we find the subluxation affecting the nerve, and that's what the pain is.
طيب Doctor, are there any cases where it's actually fixed by itself?
The subluxation itself,
Yes.
it's really hard to be fixed by itself, because once it's out, it stays out unless another force moves it back in. So very common, it doesn't. You really need it to be put back in place, kind of thing. Some cases it can, you know, but most of them it doesn't.
اوكي دكتور، بنكمل عن العظام اذا كانت خارجه شوي عن محلها. قلنا هذا التعريف بالانجليزي اسمه السبلكسيشن. What if it happens at the neck, for example?
The neck is very important spot, actually, because the neck is the one, it's below the skull, as you know, and it's the one that's most movable. So it moves a lot up and down to the sides. So subluxation in that area, it will cause a headache. It will cause even sinus trouble. It will cause allergies, fatigue. So the ones in the bottom of the skull, besides the headache, it actually can affect sinuses, fatigue, tiredness. It's like the feeling of I'm not doing well. I'm not feeling well.
والناس يمكن ما يعرفوا إنه السبب هو العظمة اللي بالرقبة اللي هي طالعة من محلها شوي.
Absolutely. But you know, if you go a little bit lower, like حتى من C1, which is the base of the skull, to about the shoulder area, about C7.
Yes.
Those are the ones that goes down to the hand and the arms, and those that actually الناس بيشوفوها إنه أوكي هاي إيدي، هاي إيدي نعم tingle.
من وين بالضبط بتكون من أي جزء؟
تقريبا من C1 to C7. C1, which is like the base of the skull, تحت الجمجمة بشوية. Like بعدين C7 it's about يعني
عند الكتاف
تقريبا الكتاف. about 1 inch higher.
وهذا بيأثر أصابع الإيدين، وبتشعر بنمنس معينة يعني.
correct. يعني بنزل على الأصابع، على الثumb.
طب شو هو اللي بيأثر على الساينس وعلى الراس؟
الساينس والراس هذا mostly the base of the skull، هذا C1 C2
لفوق شوي،
فوق
الرقبة.
Yes. Then هدول between C1 to C7 it also hits the throat, the sinuses, the thyroid, the lymph nodes, حتى التنفس كلياته related. بس شوفي هدول يعني this is what the books say. بس يعني الله سبحانه وتعالى يعني خلقنا differently. You know, we are not specifically to this. It's all overlap. You know, some people have C1, C2, C3. Some people have a little bit lower, a little bit higher. يعني it's not 100%, you know, only C1 عندك headache, you have to move C1 only. No, it could be C1, C2. It could be a little bit lower. بس لما تنزل لتحت على الأصابع, it's most likely more common to be C5, C6, C7, and the nerve is called T8, C8. Those are the ones that get you the most down the
في
arm.
كتير ناس عندهم آلام في الرأس، مشاكل في التنفس ونمنس، ما بيشعروا أصابعهم بطريقة سليمة وما بيعرفوا شو هو السبب، وبالآخر بيطلعوا مجرد زيارة لكايروبراكتيك ممكن تحل لهم هاي المشكلة.
Correct. You know, I mean, a lot of people, you know, they come in, بروح على المستشفى, بروحوا.
كلها
Oh.
علاج طبيعي، بس بدها علاج طبيعي.
You know, a lot of the cases, but يعني مرات is you go to the hospital, there is nothing there. You know, they have a headache, but there's nothing there. Well, it could be something else that's causing it. You know, so doctors say there's, you know, I don't know what to say to you, but there's nothing wrong with you. خلاص روح. So well, maybe it could be something else. So definitely give us a try, and we can help it out and see what it is.
Right. طب دكتور هلا like the other organs, how are the organs such as heart and lungs associated with the neck?
Well, you know, and this is the thing, you know, between the nervous system, as I mentioned earlier, it runs through the whole spine, you know, up to about L1, L2. But the in the neck region between C1 to C7, that's very much the head, the thyroid, lymph nodes, as I mentioned earlier. But the heart, the lungs, the pancreas, the liver, the gallbladder, the stomach, it's actually between T1 to T12, which is the rib cage. It's you know, the midsection of the spine. Between the clavicle all the way down to the lower back. So this is very much the T1 to T12. This is the one responsible for the heart and lungs and the gallbladder. But also, when you talk about the lungs, think about the asthma, bronchitis, blood pressure, ulcers, allergies. It's all related to that area. And you won't believe a lot of times that when we adjust the mid-back, a lot of cases, they say, you know, my asthma went down. You know, I don't use my inhaler as much. So it's related to that. Or people say, I sleep better when we adjust their necks. My sinuses opened up. I don't feel congested as much anymore after the mid-back adjustments. We hear this all the time. And there's more and more studies about blood pressure being decreased after you adjust the upper part of the neck. So it's all related directly and
Amazing.
indirectly.
It's amazingly related.
Absolutely. And this is how the chiropractic power for all of that. In addition to, like in the lower back region, the L1 to L5, besides the disc herniations, you know, it also affects some of the organs as well.
Yeah, and we will talk about the lower back disc herniation, الالتهاب في الديسك in details right now.
That's really important. The disc herniation, you know, when the patient comes in due to a lower back injury, as I mentioned earlier, with a car accident, work injury, and the diagnosis indicates it's a disc herniation or a bulging or anything in that nature, shooting down the legs, you really have to think about ways to fix it. You know, how this started possibly is a bone out of alignment, and then a little by little it got worse with time, or it just happened right away due to the injury. So disc herniation in the lower back is very common, and not only the musculoskeletal complaint with the sciatic nerve numbness and muscle weakness, but also the cramping, the constipation, the menstrual problem, even some kids with bedwetting, that also related to the L1, L5 area. So the nerve supply to that region is huge, and it supplies everything. In addition to this is the sacrum and the coccyx, which is like the tailbone, also responsible for people going to the bathroom and the rectum, and it's all related. You're all controlled by the brain, which comes through the spinal cord, and that's what goes down to the legs and everywhere.
So the symptoms, do these symptoms actually accompany a back pain, a lower back pain, or they can be by themselves, like alone, without the other symptom?
Yeah, this is important actually, because something called somatovisceral, meaning the spine causing the visceral problem, or it could be viscerosomatic, meaning the stomach issue, the cramping causing the back pain. So some people come in, they have a menstrual cycle. Every time they have it, they cause the back pain because the bloating, because the pressure, that's what caused the back pain. So it's kind of interchangeable. Some people go in from the back forward and people from the stomach backward. So it's different. It's
Each person is different.
different and related. It's absolutely attached to each other.
دكتور يعني how do we know if there is a bone out there in our body?
Just you need to come to a chiropractic office, come and see our chiropractor. We'll definitely check her out to see if the bone is out or not. As I mentioned, a lot of times it's painless. You don't know you have it until later on. This is when the pain starts to develop. Chiropractors, we use either the hands or we use other modalities, something called myovision, which is a muscle test, computerized muscle test to show any kind of subluxation. But it amazes me how people now, when I first started in 1997, people didn't even know what's this about. I was here in Bridgeview in 1997. People like, wow, what is that? They coming in to check their subluxations, and then in the way out is like, okay, that really feel good, but is there a way you can give me medications? Because, but between 1997 to now, chiropractors start to actually show more and more here in Bridgeview and other areas too.
دكتور يعني عم تحكي إنه ممكن الواحد ما يعرف إنه إذا عنده عظمة طالعة هيك ولا هيك، فالأفضل إنه يزور العيادة just for a regular check-up، يعني يفحص فحص عام بشكل عام، يشوف إذا كل شيء في محله، إذا في عنده أي آلام معينة أو ضيق في التنفس أو آلام خلينا نقول صداع بيعاني منها، ممكن يكون السبب هو في العظام.
Absolutely, we can definitely check her out ونشوف يعني what we can help and we can go from there accordingly.
دكتور، طب ممكن تحكي لي عن الصوت المزعج اللي بيطلع لما when you crack your bones, when you touch your bones، هذا الصوت؟
يوليا انت بتحكي كلام خطير شوية. شو المزعج يعني هذا؟ this is
ايوه، هي المخرج عندنا خالد عم بطقطق باصابعه. خالد
طول
بأشعر
بالك
بدني.
طبيعي
هذا ولا مش طبيعي؟
طبعا طبيعي، بس يعني انت بتقولي cracking. احنا شو احنا we adjust the spine يوليا، بش cracking is a tough word. But the popping noise او زي ما انت حكيت لي cracking. Thanks خالد على النويزز والdemonstration.
بس الجمهور ما سمع، المستمعين ما سمعوا.
في عندك كمان
لحسن الحظ ما سمعوا. كل شيء بطقطق عنده، رقبته وأصابعه.
The popping and cracking sound, it's actually a release of a gas bubble in the capsule. يعني imagine الjoint عليها زي ما تقولي طاقية، زي it has a cap. So when there is a pain, everything like consistently like ماسك مع بعض. So when you move the joint you release the pressure وبيطلع الصوت منه.
يعني هذا طبيعي، بالعكس كويس واحد يعمل يطقطق بأصابعه.
ما هو يعني it's not hard، بس يعني don't lock the joint. ما تمسكيش اصبعك وتمسك الولد الصغير عمره سنة وتقوله ايديه يعني take it easy شوي. بس
انا كانوا يحكوا لي اذا بتقطقي باصابع ايديك يعني بيطلعوا عوج بالاخر.
والله there is a study done about that and I read that long time ago. The only thing الأصابع لما when you تقيهم, the only thing it develops, it's just annoying sound. But there is no relationship between arthritis adjusting the spine. I mean adjusting الأصابع ولا إشي زي هيك. No, there is no relationship and it's actually fine. But زي ما قلت لك يعني don't lock the joint لما تطق الأصابع. Don't grab it وضلك تحركيهم. هلا في ناس كتير بس بيمسكوا أصابعهم ويصيروا يطقوا بحالهم لما كل ما واحد يحكي معهم بيمسك إيديه وبتبحهم.
هامل العصبية. طيب دكتور، يعني قبل ما ننهي بدنا نحكي عن العيادات الموجودة في الكايروبراكتيك سنترز في بريدجفيو وروميوفيل. What are the services available at the Bridgeview Chiropractic and the Romeo Chiropractic centers?
The services that we provide 100% of course, which is the spinal and extremity manipulations. يعني تقويم العمود الفقري وتقويم الإيدين والإجرين والركب والelbows. That's by far, this is our main job that we do. But of course we don't do this for everybody. People اللي عنده osteoporosis, people عندهم شوية issues. we cannot really use the manual hand. We use other machines شغلة اسمها activator or زي ما تقولي هيك a little device that we use to move the bones to. It does the same thing, but it's not as aggressive as the actual manipulation. So the manipulation is mainly the main thing. We use a lot something called decompression اللي هي زي ما تقول طاولة وبتسحب العمود الفقري السحب عشان تخلي الديسك يخف الالتهاب فيه. We use a lot التابينج techniques اللي بتشوفيها مثلا بالNFL players والبيسبول players. Minnesota Vikings players دائما بيحطوهم على ايديهم وعلى رجليهم. We use ultrasounds therapy, trigger point therapy, acupuncture, and we really use a lot لتقويم الإجرين شغلة اسمها orthotics اللي هي زي الدكتور شو برسي الموجودة بالفارماسيز بس it's not Dr. Show, it's more specific to the patient باش إنه anybody it's a custom made orthotic
اللي عندهم flat feet
اللي عندهم flat feet أو إذا حدا عنده high arch إذا الارش تاعه عالي كتير ومثلا a lot of females لما يلبسوا كعب عالي ولا إشي بيعطي وجع ظهري كتير. So orthotics we use this very common. Massage therapy we have 9 massage therapists on staff يعني and we use massage therapy in conjunction with the taping والultrasound والtrigger point والheat
ما شاء الله يعني services from A to Z.
Absolutely. And in addition to that we adding an additional 6,000 square feet to our offices as well to include other doctors as well. So definitely
the one in Bridgeview, right?
The one in Bridgeview.
ورح أذكر مستمعينا بالعناوين وأرقام التليفونات للعيادتين. بس قبل ما ننهي باختصار شو هم الكونديشنز أو الحالات يلي أنتم بتعالجوها باختصار عشان المستمعين يتعرفوا على هالحالات إذا حدا عنده حالة من هاي الحالات.
Well, إحنا من يعني we treat very much a lot. We treat the headaches. We hit the obvious disc herniation, car accident, work injuries. Other things, though, we really chiropractic treatment can do. يعني patients who come in with ADHD, people with asthma, with allergies, chronic fatigue, muscle spasms. I mean, because you work on the nervous system, as I mentioned earlier. Any of these conditions we definitely treat and help. But not only the musculoskeletal part, but we have to think about the colic syndrome, stress-related injuries, whiplash, wellness. Yani,
car accidents in general.
Absolutely. I mean, I wish that many patients think of chiropractic as a wellness treatment. You go to a dentist, you get your teeth checked every 6 months or every 3 months, whatever. But يعني لا سمح الله if somebody has a problem with his tooth تقدر تشيل التوث وتحط واحد تاني. بس بالعمود الفقري والباك
والعظام والمفاصل والركب.
Yes.
فيش حدا بيخلو من ألم في هاي الأجزاء.
Yes. خصوصا حماتي is very involved with that. But a lot of times if somebody has a tooth problem and you take the tooth out, it's simple to put a different tooth. صح. But for the spinal cord, وزي ما احنا حكينا إنه
you have one spinal cord.
You have one spinal cord. It has all those nerves. So if you take one bone out to put a different bone, it's impossible. Right. I mean, and people could have huge issues with that, and you can't replace a bone like that. So please take care of your spine. Please get it checked out and stop by the office. And we have like phases of treatment, phases of care for stuff like that, So like somebody comes in with back pain, of course, we have to think about their relief. We have to get them out of pain because this is what they came in for. But that, and this may be شوية بسرعة. Some patients take a little bit more. But the issue is, you came in for back pain and phase 1 very much finished. There is relief of care. شو رح نسوي after that? And this is what's important. You have to rehab the spine. You have to strengthen it to make the re-injury harder to happen. So during phase 2, we deal with, besides the adjustments, بدنا exercises. And we have the personal trainers in the office in Bridgeview and Romeville to help out strengthening and stretching exercises.
أكيد في أجزاء من العلاج، في جزء أول بعدين الجزء الثاني هو المتابعة مع المريض من خلال التمارين الرياضية المخصصة.
مظبوط. This is exactly what it is. So if you have intensive care, يعني relief care in the beginning. Second is the rehab care, and the third thing is maintaining it. And this is the one where you come in on a regular basis, once every 2 weeks or 3 weeks. Just like what I mentioned earlier about the dentist. You know, Nick, you have to take care of your spine because there is no other treatment for it besides this.
عيادة بريدج فيو الكايروبراكتيك رقم تليفونها 708-233-0707 والعنوان 7124 83rd Street في بريدجيو إلينوي. أما العيادة الثانية في روميوفيل فرقم تليفون 815-293-3000 والعنوان 600 South Weber في South Weber Road روميوفيل إلينوي. وأخيرا أكيد الويب سايت drshanab.com. شكرا دكتور رشيد. مني يوليا ريحاني ومن خالد خلفة في الإخراج. أطيب المنى وإلى اللقاء.
Thank you very much.